there, I am Jo. I am a pregnancy and postnatal exercise specialist. I'm also a maternity nurse and a mum of 3. So I am going to run you through some basic foundational movements to help you recover and restore your body after birth. Pregnancy is absolutely no easy feat. There are significant changes that happen throughout your body and of course birth as well, and this often leaves mums really feeling foreign, unable to reconnect to their body, their core, their pelvic floor muscles. Can be all a little bit like navigating a minefield. You don't know where to start, and I was absolutely like this after my first and second births. Before I do what I do now, my journey inspired me to create my business to support you to restore and recover your body after birth. So this is my trusty pelvis model. It demonstrates where your pelvic floor muscles are, also demonstrates a little bit of your core system, and also the effect or the influence that the rest of your body can have on how to restore this whole system, because obviously your core has been very stretched out the front, and weight has been, or a lot of strain has been put on your belly at the front. So back tightness you're probably feeling, and a lot of stretching in the front of your belly. Maybe you're having some upper back pain and tension. All the things, whatever you are going through, your symptoms, let it be known that you're not alone and there are solutions. Just simply get in touch with me if you have something specific that these foundational exercises don't help you set your body straight on the right journey to recovery. And of course, I always highly recommend that mamas after birth, or actually before and after birth, see a pelvic floor physio, women's health physio, so that they can do a true hands-on assessment of your body. Sometimes they will do a pelvic floor internal assessment as well, just to see how things are functioning down there and make sure you are on the right track for your recovery. This will be the gold standard. What I provide is more educational guidance and exercise, but always happy to work with pelvic floor physios to really customize as required. So what we're going to do is we're going to talk about the foundations that I teach. So mobility, to unwind those really tight postures, whether it be from pregnancy or endless hours of baby snuggles and feeding, that is causing changes to your posture that will help improve your whole core connection and pelvic floor function if we have an optimal stacked posture. So lots of mobility, opening up that chest, mobilizing that pelvis, tilting it back and forward to help restore your posture and unwind those tight spots and the tension throughout your body. Then we talk about breathing. So if we do some nice stretching of our upper body, side to side stretching, all of the things. I won't show you all of these today, but I'll give you a couple of exercises to start trying to notice, so you can practice and notice how it feels. That all this upper body stretching is going to influence your core system, your pelvic floor system, because your breathing muscle, your diaphragm that controls your breathing, is at the base of your lungs, which is at the top of your core. Baby's growing up into that diaphragm, and it may not be able to expand and contract the way that it should or previously has done, and that affects how your pelvic floor responds to this breathing. So whatever happens at the diaphragm here at the top of your core also will influence your pelvic floor muscles. So we want to reset that breathing, so that expanding in the side of your ribs, and also at the back. Often, like I said, we have that tight back, so our ribs and our diaphragm may not be functioning optimally and expanding well at the back. Okay, then we get to our core muscles. So we're thinking about our deep core muscles, not our six-pack muscles, which traditional core exercises actually target, like your planks and your sit-ups and things like that. Stay away from those. Okay, they will put too much pressure on your your core muscles, targeting your six packs, which don't need targeting. We need those deep core muscles that wrap around to help restore the strength and the stability within your body so that you can do everyday tasks well, okay? We will get to the six-pack muscles later if that's where you want to go. But at the moment, we need to restore these muscles that stabilize your body. They help reduce that back pain. They help your pelvic floor function also. And then, of course, your pelvic floor muscles. So those are the muscles, these red ones here on my pelvic model. So they hold your internal organs and your bladder, your bowel, and your uterus. They stop them from falling literally out of your body. These are the muscles that are on the outside here, the red ones. So they attach to the bottom of your pelvis, side to side and front to back. Your tailbone here at the back. And they are, so there's external muscles and there's more internal muscles. So you can see these layers. They are very complex. Now they have been stretched. If you've birthed your baby vaginally, they've been stretched a lot to get baby's head and body out. So we need to restore that range of motion, maybe heal some tears or cuts that may have occurred. And often that takes a mind-body connection. So a full body approach is really important, rather than just simply doing Kegels or these pelvic floor exercises. Okay, so to do all of this restoration, it's a bigger picture, not just focusing on Kegels. We've got to think about other things if we really want to do this well. Okay, so let's start off with some mobility. I'm going to demonstrate the mobility or all the exercises that I've put into the guide that you have access to. If you don't, I'll put the link in the bottom comments as well here. All right, so we're going to start with some mobility, some cat-cow movements. So on your hands and knees, if you have wrist pain, you can, instead of sitting like this with your wrists, you can go up on your wrist like this, or you can roll up a mat so that you're not quite skimping over the edge, so that you're not so hyperextended. And we're going to round and arch that back, okay? And notice that movement is coming from the pelvis. So we're tilting it back and forward, like tipping a bucket of water out and straightening it back up. And we're noticing this rounding, especially in that back, because that's unwinding and reversing what you have been living with for the past however many months you were pregnant for, depending on your journey. Okay. So there's no right or wrong number. It's whatever feels good for you as to how many you can do. If you have any pelvic pain on one side or the other, you can kind of rock yourself side to side, or you can do that same cat-cow movement with your knee up onto a yoga block or a pile of books and really lean into that so that you can see that your hips are side to side, a little bit higher. So pelvic pain on the higher side to unwind the tension as an option. Okay. Next up, we're going to think about our posture. Like I said, lots of rounding here. So we want to open that up. So you're lying down on your side. Again, no right or wrong. You might find you're tighter on one side than the other. In the guide, I have popped 5 per side. So lie down on your side. Make sure you've got a pillow or something for your head to lie on so that your head is aligned with your spine. Top leg out in front of you. Arms out in front, and let's open behind you and back, okay? Take that arm over behind you, and you're aiming that shoulder blade kind of to the ground. You may not be able to get far, you might only get about this far. You might get a little bit further each time. The idea of having this foot over on the front is that you're stabilizing this pelvis so that you can really get some rotation back in that upper body. It will feel good, trust me. Okay, and next, I'll give you a wee bonus exercise here, rainbows as well. So take that hand up and over like a rainbow. around. Usually this top corner over here at the back is pretty tight. And I know you're going to love this one too. All of my clients love this one. Not just in those early days after birth, but even years down the track. Good. And of course, you will need to repeat that on the other side. I want to keep this video short, sharp, and effective. So hit pause so you can do your other side. I'm going to keep going so you've got the demo of the exercises. Now that you've unwound that upper body that's a little bit tight, you need to work on your breathing. I like to do the mobility first so then we can feel like we can breathe better. Often we get lots of shoulder breathing. We want to knock that on the head. We need you to breathe down, right down, so that that pressure from that breath comes down into your core and your pelvic floor. Now we want these ribs to expand at the side, and we want these ribs to expand at the back. I call it an umbrella breath. So we open out like an umbrella and close, open out. So the pressure from that breath should go down. You should notice that pressure come down past your belly button, and eventually once you master it, into your pelvic floor muscles. We want some lengthening in these pelvic floor muscles so they then can contract. Okay, so you can do this lying down while you're still learning. We can lie on your side or sitting up when you've mastered it, because that gravity you're going to have to work with makes it a bit harder. Okay, so lie on your side or on your back. I want your head on a pillow and hand on the side of your ribs, okay? And we're going to think, inhale through the nose, past the ribs, and into your chest, expand, and then exhale out through your nose. Inhale through your nose, into the chest, keep your shoulders relaxed. Notice that rib expand, maybe the rib underneath on the ground, you might notice expand a little bit into the ground. This is what we want. We don't want you to be gripping anywhere else in your body, so it takes a bit of practice, because baby's growing up into those lungs and ribs. Hey, so you've not had this ability to freely breathe again, so it's a little bit of retraining your body. Good. Do you notice your thumb at the back on your hand around your ribs is noticing a little bit of expansion there as well? Thinking about like visualizing your ribs opening up like an umbrella. Okay. All right, now we're going to take the core into this. So we're going to inhale, noticing the ribs expand for a couple of seconds, the belly button, and then down to the pelvic floor, and exhale. Okay, so we're thinking 2 seconds, 2 seconds, 2 seconds. So noticing and building that awareness with your body and your breathing, okay? Inhale, ribs, belly button, pelvic floor, right down in that pelvis, okay? And exhale. So your tummy is going to be the weakest link because that's been the most stretched. So important to notice that we get some expansion into this side. And also the back. Now there's lots of different ways of working with that, but it takes a bit of practice, so don't beat yourself up. Just keep practicing it. Maybe while you're feeding baby, while you are lying in bed at night, just 5 or 10 breaths, just work on it. It takes consistency. Okay, and then we're going to go into our pelvic floor. So like I said, that sealing off muscles, they actually control your toileting functions. I forgot to say that before. So this is one of the biggest reasons why it's important to recover and restore the function of your pelvic floor muscles after they have been truly stretched from the weight of your pregnancy, as well as maybe through the birth. But C-sections can also impact pelvic floor function as well, because your core system, your pelvic floor is part of this core system, just like your diaphragm at the top. Okay, so inhale like we did. Exhale, we're going to think about holding in a wee, holding in a fart, using these pelvic floor muscles, just the pelvic floor muscles. Don't squeeze your glutes or your thighs or anything like that. You want to just activate your pelvic floor muscles on the exhale. So Inhale, we want some expansion down there. Exhale, squeeze in, lift up a little, 10, 20, 30% effort, not 100% effort, because that's when you're going to clench your whole body, and relax. Really important to relax. Inhale, and you might find it easier, you will find it easier to be lying down, and maybe sometimes have a little block or a ball or a cushion between your legs, okay? So inhale, notice that expansion into your core, and squeeze, lift up. Breathe all the way out. Inhale, make sure we expand that pelvic floor, squeeze your cushion or ball if you want to, and lift up. You will notice that when you do this whole process together, if you pop your hands on your lower belly, that you'll notice a very subtle flattening or activation of your core muscles, okay? And that is as intense as we need to go with that core activation. No really strict sucking in. Okay, so if you watch my belly, we're going to have inhale down and watching. Very, very subtle flattening of that core. And that is all it needs to be. And you can repeat that, those pelvic floor exercises. Lift, relax, lift, relax. 8 times morning, lunch and dinner. Okay, if you're finding you're getting any tension or pain or change in urinary habits, so you're leaking or you can't let go or you feel some urgency to need to go all the time, then we need to tone that down a little bit. You possibly are not relaxing enough, and you need to add in probably some more stretches and just breathing focus to wind that down. So there's lots of little tweaks and complications we can do if your pelvic floor is starting to misbehave or is not getting the effect, the optimal recovery that you are needing and desiring. Okay, we shouldn't have pain. We shouldn't have leaking or a feeling of heaviness down in your pelvic floor. It may take a little bit of time and consistency with exercises to improve, but just knowing that those things are common, you're not alone, but they are not normal, and there's absolutely help out there, okay? And considering your full body approach, like these foundational exercises and targets, so your mobility, your posture, your breathing, your core connection, and your pelvic floor all coordinating together will make a difference to start with. So start there and then seek more personalized help if you need it. Of course, I have online programs for postnatal recovery, so vaginal birth and C-section recovery, that you can jump onto, and these are staged progressive programs. So they start you on the floor with really mind, body, core connection, pelvic floor, and then we start building in strength for everyday life, inclusive of your core muscles and your pelvic floor, so that you can get back to functioning to the level and confidence that you want to for everyday life. So I will put the links for those programs in the comments, or you can get in touch if you have any specific questions or requests or requirements.